The UK is heading for the worst coronavirus death toll in Europe and one of the highest death rates in the entire world. Meanwhile, health workers have described truly harrowing conditions inside of our hospitals as they battle without proper protective equipment or proper resources to try and keep us all safe. Scientists have consistently told the government that we need proper protective equipment in order to contain the virus, and that nurses shouldn't be having to jimmy-rig bin bags into makeshift protective equipment to try and stave off a potentially deadly virus. AKA, when you treat nurses like literal trash, that compromises all of our health. That is a public health crisis. But Boris Johnson, in his infinite wisdom, has decided that he has a better idea. What we need now is not funding, not equipment, not resources, but what we really need is a good old round of applause. That ought to show the virus. And Matt Hancock has said, no, that doesn't go far enough. What we really need is a badge. The level of support for the health service right now is amazing, and rightly so. Health workers have had to show incredible bravery just to keep grinding on at the coalface of the crisis in truly appalling conditions. But the reality is that that bravery is a sign of government failure. When government ministers clap for the health service that they've spent a decade defunding and applaud the people that they're knowingly, consciously throwing into the lion's den, that is hypocritical, that is downright insulting. It's like punching someone in the face and congratulating them on having a particularly beautiful black eye. These are the same people that cheered when they successfully tanked an attempt to give nurses a much needed pay rise. The nurses saving lives in the pandemic, sometimes the lives of government ministers themselves, are the same people who have had to use food banks just in order to scrape by because their salaries are so paltry.
It's all very well to treat the NHS as a religion, but it's legitimate for some of us to point out that insofar as it is a religion, it is letting down its adherents very badly.
These are the ministers who have been starving the NHS of cash for over a decade, so that when a crisis like, say, a pandemic arrives, then we're already on the back foot. This is part of a catalogue of government failures, a mixture of incompetence and cruelty and a baked-in austerity mindset from a group of poor adult Etonites who fail to grasp basic concepts like human decency or maths. Reuters recently reported that they only abandoned the so-called herd immunity strategy when they realised that a tactic that might result in the deaths of hundreds of thousands of people might be slightly unpopular. They promised 30,000 ventilators, which turned out to be 30 ventilators, none of which were suitable for coronavirus patients. They shelled out £60 million on tests, which didn't actually work. They lied about where the PPE was coming from. They lied about ordering more PPE. And they've been disciplining health workers who have been protesting that they are having to put their lives at risk just to do their jobs. And the fact that that is a very inefficient public health strategy. That's not what you should have to sign up for when you want to take care of people for your job. And that is not the sign of a government who actually is invested in taking care of people. Maybe it was a bad idea to elect a government with a fundamental contempt for human life. Who knows? When the government calls NHS workers heroes whilst failing to protect them, that lets them evade scrutiny for the damage that they're actually doing to the NHS and the risks that they are taking with the lives of workers and therefore with all of our lives.
One intensive care nurse said to us, calling us heroes just makes it okay when we die.
Framing healthcare workers as people who have nobly sacrificed themselves obscures the fact that they have been sacrificed by a government who fails to prioritise their lives. It drums up an image that we're engaged in a war, and in a war, some casualties are inevitable or maybe even necessary. Tragic, yes, but not a sign that anything has fundamentally gone wrong. It borrows the pomp and glamour and nobility with which we used to talk about war to gloss over government failures. Here's a secret. When NHS workers are forced to risk their lives just to do their job, when thousands of NHS workers are forced to take time off because they've come down with coronavirus symptoms, that is not something to be celebrated. That is a national scandal. And the extraordinary bravery that health workers are having to show every day, that is a symptom of huge government failure. Those who lost their lives don't need to be called heroes by people who orchestrated the conditions of their deaths. We can honour their lives and honour what they did by making sure that never happens again. So yes, let's show support for our amazing NHS. And let's also call time on government hypocrisy. Because protecting this health service means more than shallow, self-serving praise from Boris. It means taking action now.